Hello friends, this is Sumit Bagul and I welcome you all to the brand new episode of Sex, Only Unique Formula for Happy Life. Friends, whenever we face any medical or health related problem, what we usually do? We share that problem with our family or our friends. But whenever we come across any problem which is related to our sexual life, we don't share it with anyone, rather we try to hide it. And for this reason, we have started this special sex education show called Sex, Only Unique Formula for Happy Life with Dr. Vijay Dahifale. Friends, this is one of its kind platform where you all will be able to share your sex related questions and Dr. Vijay Dahifale will guide us on how to solve your sex related problems. But before starting the actual talk, let us all know about Dr. Vijay Dahifale. Dr. Vijay Dahifale is very famous sexologist, urologist and andrologist. He has his clinics in Aurangabad, Hyderabad, Delhi, Dwarka Sector 23, Pune, Nerul in Navi Mumbai, Dadar, Andheri, Kalyan, Nashik, Ahmedabad and Dubai. Dr. Vijay Dahifale frequently travels in India and abroad for seminars and conferences related to sexology. So friends, now you all know about Dr. Vijay Dahifale's various clinics and centers. We have Dr. Vijay Dahifale here with us. Doctor, welcome to the show.
Thank you very much, Sumit.
Doctor, we are speaking about sexual dysfunction.
Sure.
And specifically in that, today we would like to know about penile implant. And by public demand, you have selected this topic. So first of all, I would like to ask you about what is penile implant treatment?
Definitely. Sumitji, here I want to tell all, most important, all line of treatments, medical line of treatment, injectable line of treatment, and last comes the surgical line of treatment, where comes the penile implant. So what is penile implant? If the treatment is resistance, means it is not responding to medical, not responding to injection, and the last stage, where patient lose all the hopes, the condition comes, we do the operation, the surgery, called as an implant. It is a penile implant surgery, and that implant definitely 100% solve the problem of sexual dysfunction.
Definitely, doctor. Now that we are speaking about penile implant treatment, I would like to know this penile implant is basically made up of what?
Yeah, this is a very big curiosity, Sumit. So many people feel that where to put the implant, the penis is such a small one, and after putting in the implant, what will happen, whether urine will come or not, if something will happen. This penile implant is made up of an inert sterile material called as silicone. And these silicone rods, they are having hinges, there are different types, and this silicone, when you put in an implant, that gives different deviations, deflections, or different inflations according to type, according to the design, that we are going to see one by one.
Definitely, doctor. I am interested in knowing all these details. But we have our first caller with us. We have Ankit with us from Delhi. Ankit, you can ask your question to the doctor.
Hello.
Hello.
Yes.
Sir, whether penile implant causes problem for urination and pregnancy?
Excellent.
Okay.
That same I was discussing.
Yes.
Means they feel that there is such a small urethra and there is small penis, where to put the implant. Whether it affects urination, I'll say no. And whether it causes any problem for pregnancy, no problem. Why? Because we put the implant on both the sides of urethra, on the upper part in the corpora, so there is no concern to go towards the urethra, so no problem for urination. And as we are above the urethra and the semen is coming from the urethra, they can go for the sex, they go very normal ejaculation, and they can go for very normal pregnancy. So not to worry with penile implant, they can do all activity very nicely. Even a person or a partner cannot identify that there is a penile implant.
So doctor, what are indicators for penile implant treatment?
Yes. Means which are the selection criteria? Means to which patients we have to do the implants. The peoples, those who are with the diabetes, hypertension, or any type of injury that is affecting the blood supply, any nerve supply damage or any vascular damage, arterial damage, where all line of treatments, medical and injectable doesn't work, then last option, which is called as a penile implant, and in our Marathi we say it's a Ramban Aushad.
Definitely, doctor. Now I would like to know about, are there any types of penile implant or what are the types of penile implant?
Definitely. On selection criteria, whether the person is younger, whether he how his IQ is there, whether the person is older, accordingly rigid, semi-rigid and inflatable. Means the implants which are manual or we can move it by hands, or there are 3-piece implant, 2-piece implant where you have to put in a reservoir, then penile part, and then part which is kept in the scrotum. With the hand, by pumping mechanism, we can make it erect or you can make it down. So these 3 types of implants are available, but we select according to the patient choice, even patient's requirement and patient handling capacity or his intelligent quotient.
Definitely, doctor. We have one more
Yeah,
caller from
sure.
Goa. We have Rakhi with us. Rakhi, you can ask your question to the doctor.
Good evening, sir.
Good evening.
Sir, I want to ask you a question. Whether penile implant create any problem to vagina during sex?
Okay, excellent.
I
I'll
think this is
appreciate
very
that.
important
Yeah.
question.
Means we are only discussing about male and male. Now think of female. Means after putting an implant, so I always say, first take the permission of your partner because she is going to receive that implant inside. So whether it is painful, whether it will harm her, definitely I'll tell them, when do the implant, it doesn't harm by any mean.
Okay.
It doesn't harm because it's a very soft, very delicate. It will give the erection, it will do the movement, but there has to be some precautions because sometimes when female on top, in that position, as the silicone is erect, there should not occur wrong hitting by pelvis or in a vigorous contact. There should not be bend to the penis, otherwise it will get a rupture of a penis or damage to the penis. So it's a very important, she will not get any problem, but for male, she has to be very careful.
Definitely, doctor. Now I would like to know about procedure of penile implant.
How to do it.
Yes, how to do it.
Yeah, the all viewers will be very interested in this. This is done under spinal anesthesia.
Okay.
This is a 1-hour procedure. After all aesthetic precautions, we have to take this incision at penoscrotal junction. We have to open up the carpora. We have to dilate the carpora, take the measurement. Then you have to cut the implant accordingly. Then you have to put a distal and proximal part. You have to suture it. After suturing, there has to be taken rest for at least 8 days, and they are not supposed to perform the sex for 1 month, and they should not sit on a hard subject, bicycling or motorcycle riding. They should not do it. After the permission of doctor or sexologist, urologist, and andrologist, they can go for the performance of the sex.
Definitely, doctor. Now a very important question. That is, what are the complications of this
procedure?
Yes.
Yeah, every procedure has its own complications, but if it is in the safer hands, a perfect and experienced sexologist, urologist, and andrologist, complications are very, very less than 1%. What are complications? Sometimes it's if there is overfitting, there can be erosion, there can be perforation of a carpora, that implant may come out. Sometimes ulceration, or if suppose there is a smaller shape of implant, there occurs hobbling, means there is a vibration of the implant. So it should not be over tight, it should not be loose also, and should be done with the proper aseptic precautions by a proper hands. Those who are experienced in these penile implants and those who are sexologists, urologists, and andrologists, they will get an excellent, superb, outstanding result. And these people should not lose the hopes. Everybody has a right to get it done and to enjoy his life. That's why we call as sex one of the unique formula for happy life.
Happy life. Definitely, doctor. Thank you so much for all the information that you have shared with us, and I'm sure definitely those whoever watched this episode will be benefited out of it.
Yeah.
So friends, you know about Dr. Vijay Dahifale, and I'm sure if you have any questions related to your sex problem, you can ask your question directly to the doctor through the contact details shown on the screen. It's time to stop here. See you in the next episode. Thank you.